is Dr. Malika from Aero Dental Clinic. Today I am going to tell you about the single sitting RCT which I learned here in my general dentistry course. So let's start with it. Firstly, we'll be using the endomotor. This is the endomotor. Okay. So for single sitting RCT, we'll start with access opening. When we have done our access opening, then we'll negotiate the canals with DG16. This is DG16. We'll negotiate our canals with DG16. Then after negotiating canals with DG16, we use 10K number 5. So you'll have to do what you have to do is take some EDTA. Okay? Either you can place it in the canal or you can place it here and put some EDTA over this 10K file and then put it inside the canal till it goes freely. Then you can stop it. Then after that you will be using your endomotor. I have opened it now. So firstly, after negotiating it with 10K file, till the time we have not used any apex locator for working length, so we'll do so now I have used orifice opener firstly. After I have used 10K file, then I'll be using orifice opener here. So this is the orifice opener. I'll mark it till 15 mm. As I have seen in my diagnostic X-ray, so I have seen there how much can be the working length with an idea, and then I'll be checking it for 15 mm. Then I'll be using orifice opener to open up the orifices which I have found from the DG16 and my 10K number file. So this way it works, and it will go like this. Inside the canal it will go like this. So now after orifice opener, you'll have to use, either you can use 26 number file or 25/6 number file. Okay, this is 26% taper, this is 25/6% taper. So I am using 26% taper. So this is 26% taper. I will take it till 15 only. Okay. So I'll be marking it till 15. This is endo gauge where we'll be marking as our files and stoppers. So this is 26%, or you can use 25/6%. Then we'll enlarge a coronal portion, because for single sitting RCT, if you have to do it in a limited time or in few time, so you will be using this crown down technique, where we firstly use the orifice opener, then 26% or 25/6%. So this will go like this, and it will go till 15 mm only, 15 to 16 mm only, according to the canal which you have seen in your diagnostic X-ray. So we'll place it in the canals, all the 3 or 4 whatever canals are there. So this will go like this, and this will clean up the coronal portion. Okay. So now after this, what we will be doing, after using 20 number 4% file, we'll be using our 10K number file. Now we'll be checking our working length. Okay, with 10 number file, this is the, you can see here, this is the apex locator which I will on from here, and this is the clip. So this one is the lip clip which goes inside the cheek of the patient, and this is the portion which will paste it in the canal, file. Okay, like this. So this is your stopper, and this will be your file. So whenever you place it inside the canal, you will go inside the canal and you will place your apex locator like this. and it will tell you, it will show you here your apex. Okay, I'm doing just like this only, but it will show you apex like this. So these are the markings, as you can see, from 0.0 to 0.5, 1.0 to 2.0. Okay, so this one shows the end of your apex. So either you can put it to 0.0 or to 0.5. Then what we'll do, after checking our working lengths on all the canal, then we'll be placing it, and then after 10K file we'll use 15K number file. Okay, we'll do this pre-curving. Always whenever we are using the hand files, either it is 10 number or it is 15 number, we'll be pre-curving the files. Okay, so this is the 15 number file, which will be enlarging the canals after 10K number file. After this, now you can come to your rotary. So you will be using this 17 number file, which is 4% taper. Okay, these files have a 2% taper, and then we can go directly to the 4% taper. So then we'll use this 17 number file, which is white in color. It is 17 or 15 in different companies. So we don't need to pre-curve these rotary files. Okay, so they'll go straight away. So now since I have taken a working length and I have measured it like this, so just like our working length is 17. Okay, so then we'll mark this stopper at 17 only, not beyond that, not short of that. So this is 17 I have marked here. Okay, so now we'll go in crown down portion only. We'll use crown down technique. So it is endomotor. So firstly we'll be using this file. Okay, if you want to use EDTA, you can use it. If you don't want to, you can also go with it. During this all the procedure, while we are filing inside, we'll have to use hypo and saline, hypochlorite and saline. Okay, so somewhere we can use only hypo, or you can use saline also. So we'll place hypo inside the canal. Okay, we'll put hypo inside the canal, and then we have to activate it with the endo activator. We'll activate it with endo activator, and then we'll use filing. Okay, so these files clean and what they do, they shapes the canal, and while hypo cleans the canal. So this way this will go inside the canal just like this, and we'll use a stopper till our apex or the working length we have taken earlier. So it will go like this inside the tooth. So after this file number, we'll be using this 24%. This is yellow in color. This is 24% file. So we'll be using it, and again I am taking this rubber stopper to my working length, which was 17. So this is 17. Then with this, like this, inside the canals, or either 3 canals or 4 canals or 4 canals, whatever it is, will go like this inside the canal. Your chair position also matters a lot while you doing filing and everything. In between our filings, we use hypo inside the canal. We place hypo and then we do filing, and we can even use saline also to clean the canals and to clean the chamber and the pulp. Now in some patients, if there is some lesion beneath the apex, or patient having pain, a lot of pain, then after doing our BMP or cleaning and shaping, we can place calcium hydroxide inside the canal. So this comes in powder liquid form and as well as in this tube form. So these tube forms are better to place inside the canal. So you can directly put this, see how thin is this tube here. So we can directly put it inside the canal and then we can place it inside the canal. So what it will do, we'll leave it for 1 week or 2 weeks, and then we'll check patient is pain free or not. Then we can start with our obturation. If the patient is pain free, we can go with the obturation, and if still the pain persists, we can again clean up the canal and again place calcium hydroxide inside the canal and then leave for 1 week also. So this was all about the root canal treatment. This was my experience here. I had to tell you. Before that, whenever I used endomotor, so I didn't know how to use it, what techniques we are using, how to use hypo exactly. So here in Aero Dental Clinic, I used everything. We have been provided with each and every product, each and every material here, and each and every product we have whatever we want. Either these are new file systems, and these are rotary files which we are using. These are hand files which we are using. Endomotor, this is endomotor, this is endo gauge, and these are the materials, EDTA, calcium hydroxide, and everything. We also have Metapex here. If you want to use Metapex instead of calcium hydroxide, you can also do that. And this is the apex locator, which is very important while you do your so this is all about here. So it was a very nice experience learning endodontics here. It was very nice, very nice. I have learned a lot of things. There was many things missing which I learned here. So thank you so much. Thank you Aero Dental Academy for teaching me all the stuff which I really wanted to learn. Thank you so much.